Hi, everyone, and thank you so much for coming to our presentation today about SNAP, the Supplemental Nutrition Assistance Program. This program is for parent leaders and people who are supporting parents and families to access this resource. Before we get started, who are we? My name is Alex Lacramaya. I am the Child Nutrition Vista working with Hunger Free America, an organization based in New York City. And this is my partner, Juliana.
Hi everyone, my name is Juliana Pereira. I'm the Child Nutrition Programs Manager at Hunger Free America.
And Hunger Free America / Hunger Free NYC is our organization that we're working with. Hunger Free America is nonpartisan, national, and a nonprofit group, and we work to enact policies and programs to end domestic hunger and ensure that all Americans have sufficient access to nutritious food. So Hunger Free America operates on a national level, and we also have one branch called HFNYC that works directly with New Yorkers across all 5 boroughs and helps them to access support and education around our federal and local nutrition programs. And we have a team that does a lot of direct access for folks here in New York City. For this training today, we have a few different sort of modules of trainings around these topics, and they range in level of complexity. So there's our low touch option is more of a passive approach. A low touch mentality would be more about simply passing along information that you receive. On the other end of the spectrum is the high touch, which would be a training that would bring somebody up to the level of an expert. That's not quite what we're doing today. We do have a number of experts on our staff who are experts in SNAP. So if folks are looking for an expert, we encourage them to reach out to us. This training is going to help you become sort of a mid-touch specialist in SNAP. So you can take a more active approach in promoting SNAP for families, for parents, for people that you meet who might benefit from the program. You'll have a working knowledge of SNAP, and you'll be able to help potential participants assess their eligibility and help answer questions and help direct them to further resources after this presentation. In summary, what we're going to cover is what SNAP is at a basic level, the history of SNAP, how it came to be in this country, the basics in determining whether or not a family might be eligible for SNAP, and then how to help families apply for the SNAP program.
Thank you, Alex. Now I'm going to talk a little bit more about the program, how it's administered, and what it really looks like and functions like. As Alex mentioned, the SNAP program stands for Supplemental Nutrition Assistance Program, formerly known as the Food Stamp Program. It is still commonly referred to as that nationally, but the SNAP program is the official name, and it's a federally funded anti-hunger program. This program provides monthly benefits to food insecure families in the US through an EBT card. An EBT stands for Electronic Benefits Transfer. They can be used just like a regular debit card at thousands of retailers throughout New York City. As a federal program, it starts first with the USDA, the United States Department of Agriculture. They create the national standards that then each state sort of shapes and creates their own rules. So in New York, that's the Office of Temporary Disability Assistance. They're the statewide organization that distributes the benefits. And then at a city level, we have HRA, which is Human Resources Administration, and they create their own rules and procedures within the state and federal guidelines, and they will process applications and determine eligibility based on those federal laws. SNAP has an immense impact on hunger beyond just alleviating the immediate food insecurity of its participants. For every dollar in SNAP benefits that are spent, it generates $1.70 in economic activity. So if you think about it as if someone who gets SNAP, they're going to be using that money in their local grocery store, in their local pharmacy, at their local farmers markets. And that's extending the benefit even further by keeping that money within the community. $68 billion were spent in SNAP benefits by the federal government. And out of that 68 billion, 92% of that went towards the purchase of food. So that's a ton of money that is being spent and is being sort of recycled in communities where people are using SNAP benefits. Continuing on with the impact of hunger, I think we always hear about food banks and soup kitchens being the solution to food insecurity. Well, the reality is that SNAP is much more effective, much more efficient. In fact, for every one meal that a food bank, soup kitchen, such as the Feeding America Network, serve, SNAP provides 9 meals. So it's really 9 times the value of what the food bank can provide. SNAP benefits can be used to purchase groceries at a variety of stores and markets, supermarkets, pharmacies, farmers markets, and recently it's available online and even more widely so on retailers like Amazon, Walmart, Aldi, etc. They can be used to purchase eligible items at participating retailers. So your EBT card is, as we mentioned, functions just like a debit card. So you can use it really most anywhere you can buy groceries. Often SNAP retailers will have signs like these to indicate that they accept the benefit, and you'll see them all throughout the city. Eligible products, so what can be purchased with the benefits, include a huge variety of foods, fruits and vegetables, canned food, meats and seafood, dairy products, bread, grain, pasta, beverages. These are all eligible with your SNAP benefits. What cannot be purchased with SNAP benefits, however, are ineligible products. These include alcohol, cigarettes, tobacco, non-food items like toiletries, pet food, toilet paper, stuff like that, as well as hot foods. However, there are some exceptions with the hot food situation regarding our elder SNAP clients. Using the benefits in addition to the EBT card is super easy. Again, it's just like a debit card and you can manage it online or over the phone. We love Access HRA. It's a great website through which you can manage your benefits. You can also call the New York EBT customer service line at this number. There's also the Access HRA app, which has really taken things to a next level and really increased accessibility. You can upload your document images so you don't have to worry about bringing, official documents anywhere. You can check balances, apply for and manage benefits, and also recertify. So there's a ton of things you can do. Whereas before you would have had to go into the clinic, now many of these things can be done easily and over the phone. There are a lot of widespread myths about SNAP, which we think prevent people from participating, prevent people from learning more. So we wanted to highlight a few of these today. The first myth is that SNAP is a cash program. That's not true. SNAP doesn't provide cash. It's a nutrition assistance supplement that can only be used to buy food. The goal of the program is to increase a household's ability to purchase these nutritious, healthy foods from neighborhood food stores. And so it's not to provide cash, but it's to provide a supplement for food. Another myth is that people on SNAP don't work. That is totally untrue. Most households on SNAP have at least one person working, and at least 1/3 of households have more than one job to provide for their families and still qualify for the program. So we see this as a dangerous myth. Most of our SNAP families are working and are working really hard. Another myth is that SNAP is considered in a public charge test. That is no longer true, and accessing SNAP will no longer negatively impact your efforts to obtain a green card or citizenship. And we will talk about this a little bit more when we get in the immigration piece. Our next myth, I am not eligible for SNAP because I do not have an address. That is not true. You don't need a fixed address to be eligible for SNAP. So anyone, a person that's experiencing homelessness, can still receive the benefits. They can list a church or work with a CBO and use their address. There are a lot of options for someone to still get benefits. You also don't need to prove you have a working kitchen. You can still get the benefits. Our last myth, which I think is one of our more dangerous ones, by accepting SNAP, I am taking money away from someone who needs it more. That is not true at all. The SNAP program is an entitlement program. So that means it grows with need, and anyone that applies and is found eligible for the program will receive benefits. So by accessing SNAP, you would never take away something from someone else that needs it more. That's not true. Okay, and Alex is going to take us through a brief history now.
Thanks, Juliana. Now we're going to talk a little bit about where SNAP came from. During the Great Depression, there was obviously an enormous amount of poverty and need, and this is where our story starts. Weak sales for grocers, as well as hungry citizens, led President Franklin D. Roosevelt to establish the first food stamp program in 1939. So this was an issue where we were addressing multiple problems at once, getting people fed, helping farmers, and helping stimulate the economy during a very difficult time in American history. The United States Department of Agriculture, which we talk about a lot in this presentation, they're still the ones who administer the SNAP program, sold food stamps to low-income participants who could exchange one ordinary dollar bill for basically $1.50 in food stamps, which would allow them to purchase food. So $1 in orange stamps and 50 cents in blue stamps. And the way that this was originally set up to address some of this food surplus issues in the economy is that you would get your dollar back in orange stamps that could be used to buy anything, and you would get an additional 50 cents, which you could only use to buy surplus items, which would help to encourage people to purchase the surplus items such as beans, eggs, and fruit. This program ended in the spring of 1943. Since the conditions that brought the program into being, unmarketable food surpluses and widespread unemployment no longer existed. So as we can see, this transition happens around the beginning of World War II, where there was a massive upward shift in economic activity. So there was no longer the same level of need among Americans, although there was still need, and there wasn't the same level of issue with surplus food. We jump forward a little bit through the 40s and 50s, which were generally considered to be times of surplus and wealth. And though that's not an entirely accurate picture, that's sort of how it's painted within the historical perspective and how people were viewing it at the time. Before winning the 1960 presidential election, we have John F. Kennedy, who was campaigning in the state of West Virginia during the Democratic primaries, witnessing poverty once again. So this issue of poverty and malnutrition amongst Americans is getting brought back up to the national focus at the beginning of the 1960s. In 1961, in order to respond to this issue, JFK issued an executive order that started another pilot food stamp program in several states, including West Virginia, where he visited. And this program was based off of the earlier program from the 30s. These food stamps came in booklets containing food coupons of different denominations that could be used just like ordinary money. They could only be spent on food. And the booklets were printed by the Bureau of Printing and Engraving and backed by the federal government. So the federal government affirmed that these coupons had value and made sure that their exchange was valid amongst different sellers of food across the country. In 1988, the Hunger Prevention Act permitted additional pilot projects to test whether the use of benefit cards and other automated or electronic benefit delivery systems can enhance the efficiency and effectiveness of operations for this program. So here we start to see us moving food stamps into the modern era. And we see the first instance of EBT being used here, electronic benefit transfer. Today, the EBT system is nationwide and went nationwide in 2002. This was designed in part to reduce fraud, which is a small issue, but an issue on occasion, and also to reduce stigma for participants who could potentially be identified when they didn't want to be identified by having that very recognizable book of coupons. Now that we have EBT cards, participants can simply whip out another card from their wallet. It looks like a debit card, and it's very easy, simple, and inconspicuous to use.
Thank you, Alex, for sharing some stories about the history of SNAP. Now we are going to move on to talk about basic eligibility for applications and breaking that down a little bit so it's a little more easy to understand. So what determines SNAP eligibility? There are generally three main categories that we focus on, the first being household size, then citizenship or qualified immigration status, and then household income. Once eligibility is determined, household expenses are then reviewed to determine the benefit amount. So we're going to start with household size. Household composition is determined by members in the household who buy and prepare meals together. There are a few types of households that are considered mandatory. Now, this means that you must apply for SNAP jointly. These include spouses, partners with children in common, individuals under the age of 22 living with their parents, or children under the age of 18 living with an adult who is providing 50% or more of their support. Then there are what we call voluntary households. This means you could apply for your own SNAP cases. These may include relatives, so sisters who, siblings or uncles, aunts, cousins who may live jointly, or adults with children aged 22 and over, or roommates. There's also something that we call special household arrangements. So elderly individuals and or disabled individuals may qualify for a separate household status, even if they purchase or prepare meals together with other household members. And this is intended to increase the benefit amount for that elderly individual, understanding that they may have, additional costs as well as a very fixed income, as well as someone who is disabled, and kind of allows them to reap the maximum benefit amount by applying as a separate household. As well as someone experiencing homelessness, they don't need a permanent address, as I mentioned, or access to a kitchen. All they need to do is provide the proof of identity and mailing address, again, working with a church, another community-based organization, or even a SNAP office would probably be willing to offer that. College student eligibility topic recently because there have been a bunch of waivers and sort of flexibilities granted by Congress to enable college students to access SNAP. They define a college student as anyone between the ages of 18 and 49 that is not physically or mentally disabled and is enrolled at least half-time in an institution of higher education. In New York, our state organization, OTDA, has expanded SNAP student eligibility to include students attending SUNY, CUNY, and community colleges. So these students are eligible if they are eligible to participate in a work-study program, whether or not they're already participating in that work-study. By being eligible for work-study, they are now eligible for SNAP. The next category is immigration status. So qualified immigration status breaks down into two main categories. We have US citizens. Those include folks that are born in the US or have been naturalized. And then we have non-US citizens, which can be a little bit more complicated. This includes legal permanent residents as well as qualified alien status folks. So for legal permanent residents, there's two options. So anyone with 5 years with the legal permanent resident status is eligible to receive benefits, as well as a child under 18 years old. On the other hand, anyone with 40 work quarters, so say maybe they don't have the 5 years, but they've been in the United States for 10 years working 40 work quarters, they would be eligible. Also, this includes anyone who's receiving SSI or SSD, Social Security insurance, or disability insurance. Under the qualified alien status umbrella, this includes asylees and refugees, victims of domestic violence, victims of human trafficking, as well as some other circumstances. Unqualified immigrants are undocumented immigrants, as well as individuals with the work permit without special status, student or tourist visas. So those are unqualified immigrants that are not eligible to apply. However, as we'll talk a little bit later about mixed status households, that doesn't mean that they can't apply on behalf of their children. And we included a few sample documents at the bottom for immigration. So children born in the US qualify for SNAP regardless of their parents' immigration status. That means parents can apply for SNAP on behalf of their children without affecting their own status. Again, going back to charge, anyone applying for citizenship will not see a negative effect if they enroll in SNAP. It is not considered in a public charge test. Another program I just wanted to mention is the Wic program. Wic has no immigration status requirement, so we love to recommend this program for our uneligible immigrant families. Families with children under 5 may be eligible for this program, and again, it has no citizenship requirement and is also not considered in a public charge test. This is a letter that the USDA shared back in March, reiterating that applying for SNAP does not make you a public charge and you will not be considered in a public charge determination. So we just wanted to share this to really provide reassurance that as of last year, March 2021, this should no longer be of concern to our immigrant families. Our next category for determining eligibility is household income. Now that we've looked at the size and we've made at the household size and we've made sure who is eligible and who is not, now we will look at the income to make sure that they still qualify for SNAP. There are 3 types of income that are looked into in a SNAP application. They consider income money that is received in a consistent basis. So this consistency may vary, weekly, monthly, quarterly. All countable income must be considered. So earned income is income from employment or income from self-employment. It can include if you own a rental property or also earnings from a job training. Then there's unearned income. This is the more passively earned income. This could be unemployment insurance, your retirement income, Social Security benefits, workers' comp. It could be contributions from friends, child support, or if you are renting out, say, a room, that would be considered unearned income. Exempt income, these are just considered one-time payments. They have no consistency whatsoever. They can include loans, personal loans, in-kind payments, one-time payments, just those things that have no consistency whatsoever. The federal poverty line is a measure of income used by the government to determine if a household may be eligible for SNAP. In New York City, we have 3 income guidelines that we look at. This is 130%, 150%, and 200% of the federal poverty line. Federal poverty level, excuse me. Households can fall under any of these 3 guidelines depending on their household circumstances. So as you can see, 130% of the FPL is for households with no income or have unearned income. So you'll notice that this income requirement is less than the 150% of the FPL, which includes households that have at least one individual working. So it really takes into consideration how many people are working, how much money they're making, and how the benefit can help supplement the family food budget. So for example, if you take a look at this table, if we have a family of 3 and the one of the parents is working, we would look at the maximum monthly income for the household to be 2,745. And that's how you can get a sense of income eligibility for SNAP. Finally, I'm going to talk about household expenses. Now that we've determined eligibility, household expenses are what determine the benefit amount. So the SNAP program only takes into consideration those expenses which are considered a necessity. So these include these 5 main categories. We have rent, other things related to homeownership, we have utilities, we have dependent care, medical expenses, as well as expenses from self-employment and child support payments. So in a household, we've seen it's very common to have a combination of eligible and ineligible members. Remember, parents who may be ineligible can apply on behalf of their children. So in order to better accurately measure the income and expenses, the SNAP program chooses to prorate those amounts. So you'll see in the kind of graphic at the bottom that we take the income and expenses of the ineligible parents in this case, divide it by the number of members. So we get the parents' income kind of as a per person basis. Then you multiply it by the number of eligible people. So that may be the 2 kids. And that becomes the countable income and expenses. So this ensures that only a portion of income and expenses of ineligible members will be counted to then determine income eligibility for the entire household.
Thank you so much, Juliana. Now that we have covered eligibility, we want to jump into what the application process might actually look like for a potential participant. So there's a bunch of different ways to apply for SNAP. One of the first ways that you can do that, which has become less common during the pandemic, is in person. People can get help applying for SNAP by heading to local SNAP areas in the city, such as SNAP centers run by the Human Resources Administration or community-based organizations. And we have some other resources that we're going to share along with this recording to help people find these HRA SNAP centers or community-based organizations. One can also always call 311 and ask to be directed to resources about SNAP. Our organization, Hunger Free NYC, has a couple hotlines available for folks who are interested in support applying for benefits. This includes SNAP and also WIC, which we mentioned earlier. Our line is available Monday to Friday, 9 to 5 p.m. And we have one line in English, which is 646-355-1475, and another line for Spanish speakers, which is 347-599-1510. You can also apply online at the Access HRA website. You can call the HRA info line to have an application mailed to you, or you can apply by fax or by mail at the shown numbers and address. This is what the Access HRA online application looks like on the initial page. So what the process for this would be to first download the Access HRA app, create an account, and then you can submit an application only via web browser on the Access HRA site. You'll send in your application and documents. Your documents will, if you send in a primary initial document, it will be returned to you. And then a phone interview will be conducted because during the pandemic, the Office of Temporary and Disability Services has extended the partial interview waiver through June of 2022, I believe. So it's possible to receive these benefits completely remotely. Here we have the document checklist of some of the required documents for receiving your SNAP certification. Each household that has a social security number needs a social security card. If you do not have a social security number, that is also okay. Don't let that deter potential participants from applying. If there is no SSN, we also would need to submit documentation regarding citizenship or immigration status and other identity documents such as a passport from any nation, a driver's license, birth certificate, documents such as a naturalization certificate or green card, and other documents that explain a potential participant's status and identity. There's also going to be a proof of income section, and there's a whole slew of available documents that can be submitted as proof of income. So job letters, unemployment letters, pay stubs, last 3 months of income or tax records. It's also possible to submit a self-declaration of income if, for example, you don't have this previous paperwork and your boss is not willing to submit a job letter on your behalf. Once an applicant is determined to be eligible, there will also need to be a discussion of the household's expenses to determine the level of SNAP benefits that will be received. So some documents that will show proof of expenses would be a lease or a rent receipt or a letter from the landlord, documentation of utilities, documentation of mortgage, child care letters or receipts regarding dependent care, and copies of medical bills for patient clients over 60 who are receiving disability benefits or SSI. And then also, of course, participants need proof of address. It's going to be for all members on the case. So this can come in the form of postmarked mail, a letter from a doctor or a school, or a letter from the landlord indicating the address. So this graphic begins a timeline of the application process. You start with completing and submitting a SNAP application. That's going to be your day one initial step. Moving on, the interview process is going to happen probably within the next 5 days. And currently, the interview process is generally conducted over the phone. So we'll be on the on-demand line Monday to Friday between 8:30 and 5 p.m. HRI has to screen every single SNAP application. So qualified households should receive benefits within 5 calendar days of that interview. So generally around day 5 to day 10. And an EBT card will be mailed to the client's mailing address, which is part of the reason why proof of mailing address is such an important document. And just as a note, a lot of this remote interviews or waiving interviews is currently an aspect of waivers in place because of COVID-19. So this is a great time to apply. All necessary documentation will also need to be submitted before a client starts receiving benefits. So this could be sort of lined up with the timeline of the interview, and the submission of other applications can be anywhere around day 5 to day 20. And the client will receive an HRA approval or rejection notice by day 30, so within the month. And if a client is rejected and wishes to dispute the outcome, which is something that can happen, this is something that our benefits access specialists do see. And one of the things that they are really skilled at is helping applicants dispute a rejection and make sure that people who are eligible and something went wrong in the application process can receive those benefits. So from day 30 to day 60, if a client is rejected, they can go through the hearing process and request to speak to a judge and have that rejection reviewed and possibly overturned. So why apply with us, with Hunger Free America, as I just mentioned, or with Hunger Free NYC, which is our local benefits access crew? One of the great things that they offer is expertise and connections so they can help people dispute possible rejections. They have a strong relationship with HRA and an understanding of how HRA functions. So they're able to really help clients navigate the little things in the system that are not currently obvious to people who aren't familiar with it. Our benefits access specialists will follow up with clients, keep in touch with clients, can communicate with clients in both English and Spanish. And if clients need access to another language, we also have a great phone-based translation service, which operates in pretty much every single language under the sun. So definitely feel free to refer people to us regardless of the language they speak. Our services are remote and in person. We have also the ability to refer clients to other services if they need assistance with housing, if they need assistance with cash, trying to access cash assistance or PEBT. We have a whole bunch of resources, and if we don't do that on our team, we're more than happy to refer clients out. So definitely strongly suggest directing people towards us if they need assistance with the application process.
Next, I'm going to take us through some ideas, some best practices for connecting families to SNAP and kind of how to get the conversation started. So you should really talk to everyone. You never know who could benefit from learning about or participating in the program. Um, most of the best outreach really comes from word of mouth. You know, someone having a great experience with something and talking about it to their friends, their neighbors. And so we really encourage everyone to learn more about SNAP, to share the information with everyone they know, and to just get talking about it. Clarify the name too. Not everyone knows that SNAP is, food stamps. So clarify when you talk about SNAP that you're referring to the program that they might know as food stamps. But really encourage the use of SNAP so that people begin to recognize that the name, out and about. In Spanish, SNAP is commonly referred to as cupones de alimentos. That's something we've also heard a lot. We should really be working to combat the stigma. So some people may think that accessing SNAP is shameful or indicative of failure. And it's really important to stress that it is widely used by millions of Americans every year for many different reasons. As I shared earlier, 1/3 of SNAP families are working at least 2 jobs and still qualify for the program. So we know it's not a matter of being lazy or expecting a government handout. This is really an effective program to help families get beyond food insecurity and to really supplement their food budget so they can make healthy food choices. Lastly, remember mixed status families. So many people still don't know that a mixed status household can receive SNAP funding. We've seen a lot of what we call a chilling effect from the public charge conversations. And a lot of our immigrant families are wary and afraid of accessing these federal programs. So remind them, even if you're not eligible, you can still apply on behalf of your children, and this will never impact your efforts to obtain citizenship or stay in this country. We wanted to include a few potential talking points as well, just to get the conversation started, or if some of you may, need a little bit more support doing that outreach. We love to talk about how the SNAP program provides funding to help buy food that participants choose. The food pantry really eliminates choice. You kind of get what's there that day, whatever's in abundance, that whoever's donating. With SNAP, you can go to the store, you can pick the brand that you want, you can pick the ingredients, the spices that you like, and it really allows you to buy anything that you'd be interested in buying to feed your families. SNAP is available to support families who want to expand their grocery budgets. It provides up to $250 per person per month in New York. SNAP is easy to use. The cards look and work pretty much like a debit card. They're inconspicuous, you don't have to take out a big coupon book, and it's really easy to use now. I'm looking to spread information about SNAP to as many people in our community as possible. can I share a flyer with you? This is a great way to just, talk to someone who, when you're doing outreach, maybe by a food pantry or in your school. It's always great to just approach anyone. And lastly, due to COVID-19, in-person requirements for applications and recertifications have been waived. It's now easier than ever to apply for and receive your benefits remotely. We really want to emphasize how much easier it is now to get your benefits without having to go to the clinic, without having to, leave your house.
All right, thank you so much for talking about those great ways to connect with potential participants and families. I'm going to bring us home by touching on some additional benefits that are also available in the SNAP program. The first is health bucks, and a lot of these additional benefits sort of harken back to what we were talking about in the history section about both supporting families and supporting local agriculture. So health bucks are a great program in which coupons sponsored by the New York City Department of Health and Mental Hygiene can be used to purchase specifically fresh fruits and veggies at all New York City farmers markets. So aside from supporting participants, it also supports local farmers who participate in our farmers markets. This incentive stretches a SNAP budget and encourages shoppers to spend more of their monthly food assistant allotment on fresh produce from these markets. So the way this works is the participants receive $2 in health bucks for every $2 spent using your EBT card at a farmer's market. So daily, you can receive up to $10 by spending your SNAP money at a farmer's market and receiving that $10 back in health bucks. And if a participant is looking for more instructions on how to use these cards at farmers markets, they can access the Grow NYC website. And also, we want to emphasize that farmers markets are available in all 5 boroughs. So included in our resource packet, we're going to have a little information about where you can find those farmers markets and what farmers markets might be available to people in your community. Next, we have the Commodity Supplemental Food Program. So this program is directed at seniors. A couple things in SNAP are a little bit different for seniors because there's an understanding that seniors don't always have the same capacity to cook and prepare meals as many other SNAP participants. So this particular program offers free nutritious foods to seniors age 60 and older who are eligible for an additional monthly box of food. Approximately 33,000 seniors participate in CSFP monthly. And as well in our resource packet, we're going to include a local agency provider that can help connect seniors to this benefit in New York City. During the summer months, these participants also receive additional benefits to purchase fresh fruits and veggies at farmers markets through the Senior Farmers Market Nutrition Program. And the way that this particular program works, harkening back to the original food stamps system, participants are going to receive a coupon booklet. The booklet has 5 coupons valuing $4 each, so $20 in total. Another program available is the Pharmacy to Farm Prescriptions program. And this program sort of takes the idea of using food as a prescription to address medical and health issues. So patients who are part of the SNAP program who have a prescription for high blood pressure medication at certain pharmacies in New York City can also receive a sort of similarly placed prescription for fruits and veggies that can be exchanged at farmers markets for $30 in health bucks each month, which again encourages participants to support local farmers and also especially encourages participants who have medical issues related to a lack of nutrition. It especially encourages them to access fruits and vegetables for their diet. We also have the Get the Good Stuff program. This program is also for SNAP participants to get more free fruits and veggies, as well as beans and legumes at certain supermarkets. So the way that this program works, for every dollar you spend using SNAP on eligible fruits, veggies, and beans, a participant can get $1 back in matching rewards points. This is up to $10 a day, similarly to it at farmers markets. And eligible foods include fresh fruits, veggies, and herbs, frozen fruits and veggies, canned in jars, fruits, veggies, beans, and lentils, and dried beans, lentils, and fruits. So simple fruits, veggies, and legumes without added salt, sugar, or fat in whatever form is best for the participant. SNAP also offers a little bit of additional services for participants. And we want to emphasize, sorry, not SNAP, HFNYC offers a bunch of services through our benefits access team. So again, we have our hotlines in English and Spanish to access our benefits access team directly here in New York City. They're available Monday to Friday, 9 to 5. We also offer a lot of trainings for all sorts of different communities about these programs, SNAP and WIC, as well as PBT, school meals, summer meals, local food advocacy, and understanding nutrition insecurity in New York City. So if you're interested in learning more, please feel free to contact our organization or specifically the Child Nutrition Department. We have Juliana's contact information here. We also offer our neighborhood food guides, which is a great resource to just hand to people who need immediate support. So these food guides offer information about where food can be accessed in all 5 boroughs. We have access to this online where you can go and fill out a form and order it directly to the address of somebody in need. So that's another great resource we have for people who want to get a little bit more involved in HFNYC. So thank you so much for listening to this presentation. If you have any further questions, please feel free to contact us. We are always ready and willing to talk a little bit more with people looking to support the New York community in accessing nutritious food.
Thanks, Alex.